So I do want to announce that today we have a new case of COVID-19. So this will be a total of 13 cases that we've had here in British Columbia. This is an individual who is in her 80s and resides in the Vancouver Coastal Health Region and recently returned from travel to India and Hong Kong. Unfortunately, she's had quite a severe illness, and she is currently in critical condition in isolation in the ICU at Vancouver General Hospital. So the hospital, of course, has been preparing for this and has taken all precautions to ensure that everybody in the hospital, the healthcare workers, the visitors, the other patients, are safe and are being protected and providing her the care that she needs at this critical time. So the case is a presumptive positive based on testing that was done at VGH and will be confirmed at the BC CDC. So just to give a recap then, this is our 13th case. As you're aware from our previous discussions, 4 of our cases have now fully recovered, and the others are all in isolation at home and are in stable condition. We have no new contacts who have developed this in the many contacts that we're following, or the small number of contacts that we're following from all of these cases. Vancouver Coastal Health continues to actively investigate this new case and the other ones that we announced in the past couple of days. Close contacts are being identified and contacted and are monitored, those who are at risk. We're supporting them to be in quarantine, to be isolated at home for 14 days and active monitoring for symptoms. As you know, the risk is changing day by day globally, and we are continuing to monitor carefully. We also, within British Columbia, the risk still remains very low in our communities here and in the province in general, and in Canada the risk remains very low. So we continue to work closely as well with our federal partners around travelers who are returning to Canada and to British Columbia, and currently we are asking anybody who's returned from Hubei province or from Iran to self-isolate for 14 days, and we are contacting them to ensure that they have the resources and are able to do that. So that's our update for this evening.
Dr. Henry said she's in her 80s?
80s, yeah.
That's correct, in her 80s.
Yeah, she's in her 80s. Premièrement en français, and then I'll say a few more words in English. Nous annonçons un nouveau cas de COVID-19 en Colombie-Britannique pour un total de 13 cas. Le 13e cas est une octogénaire qui a récemment voyagé en Inde et à Hong Kong. Elle est mise en quarantaine à l'unité de soins intensifs de Vancouver General Hospital. Les responsables de la santé publique enquêtent activement et tous les contacts étroits ont été identifiés et contactés, ou va être identifiés et contactés. Ceux qui peuvent être à risque d'exposition sont maintenant isolés pendant 14 jours et font l'objet d'un suivi actif quotidien des symptômes. Very clearly, this is a serious situation, our 13th case, and it reflects the seriousness with which the healthcare system takes every single case, and that is reflected in the actions of healthcare professionals, healthcare workers in this case. Obviously, our hearts go out to the family, and we are doing everything we can to support this patient and all of the patients who are dealing with the consequences of COVID-19. As I said in the legislature, part of our preparation, and this is part of that significant preparation since more than a month ago when our emergency response was set up under the direction of Dr. Henry and Stephen Brown, the Deputy Minister of Health, has been to prepare health authorities, and in every health authority, in fact, there's an emergency operations center in operation now to address COVID-19 as we address issues in the future. This preparation, I think, is critically important and will be critically important as we address issues in the coming days and weeks. And I wanted to thank all the members of the public again for their continued support and work on these questions, on their support for people in the community. Obviously, this case is another serious one, and that's why we chose to come here today and again brief you to keep the media and the public informed as to what's going on in our province.